It's not the most comfortable topic, but in today's health headlines, we're talking about STDs. Some cases of sexually transmitted diseases are increasing here in the state of New Hampshire. Here to tell us about them is New Hampshire State epidemiologist Dr. Benjamin Chan. Thank you for being here today. I appreciate it.
Thank you.
Which ones of these diseases are we most concerned about, and what symptoms should we be watching out for?
Yeah, so public health tracks a number of different sexually transmitted diseases, or STDs. Chlamydia, gonorrhea, syphilis. These are three different bacterial infections that nationally we're seeing increase. In New Hampshire, the largest increases we're seeing are in gonorrhea and syphilis. The symptoms of these infections really vary depending on which infection we're talking about and the location of infection. Early on, people may have very few symptoms or mild symptoms. So with chlamydia and gonorrhea, they can present very similarly with burning or pain with urination, discharge from the urethra or vaginal discharge. They can also cause infection in the throat and the rectal area. But if these aren't treated, they can go on and develop more serious complications like pelvic inflammatory disease. Syphilis oftentimes presents as an ulcer at the site of the infection, and if that's not treated, it can go on to disseminate and spread throughout the body, causing rash and infection in different organ systems. So these can be very serious infections, and in fact, with the increasing syphilis cases nationally, we're seeing increasing congenital syphilis, which is where a pregnant mother can become infected and then pass that infection on to into her unborn baby that can lead to birth defects, death of the baby. So these can be very serious infections.
Can you give us some idea of how much of an increase there has been here in New Hampshire for syphilis and gonorrhea?
Yeah, so syphilis has more than doubled the last few years. Last year we had over 100 cases of syphilis. This is compared to, in years prior where we've seen very few syphilis cases. We've also seen an increase in congenital syphilis. We've had a couple cases of congenital syphilis in the last year, whereas in prior years we've seen very few, if any. Gonorrhea, historically we've had about 130 cases of gonorrhea diagnosed per year. There were some dramatic increases in 2016, close to 500 cases, and then last year over 600 cases of gonorrhea. So all of these are increasing.
Real quick, how can people out there protect themselves from these STDs, and should anybody be getting tested right now for these? Yeah,
so the good news is that STDs are preventable. So abstaining from sex is the surest way of preventing a sexually transmitted infection. But people are going to have sex, and so we encourage them to limit their sex partners, use condoms consistently and correctly, be tested themselves and their sex partners before engaging in sexual activity. And then picking up infection and treating infection quickly is important to preventing spread. So people that are having symptoms should talk to their healthcare provider. People who have a sex partner that has been diagnosed with an STD should talk to their healthcare provider. Pregnant women should be screened, and then importantly, everybody should be talking with their healthcare provider about their sexual past, their sexual experiences, because even if they're not having symptoms, risk factors alone are enough to screen people and test.
Sure, Dr. Chan, thank you very much. I appreciate it.